Week 1, lecture number 7. Hello friends, this is the last lecture of first week, and again this is regarding communication. I call it communication part 2. In last lecture we spoke about communication in general particularly and communication in palliative care, and we discussed what is the importance of empathy, and we generally discussed apathy, sympathy, empathy and compassion. All these terms, what do they matter and how do they matter in our communication. Now in this lecture we have got two parts. 6-point toolkit. Toolkit means basically a checklist. There are 6 checklists. If we apply them in our communication between nurse and patient, between doctor and nurse, between patient and doctor, then the communication will become effective. And then there are certain important protocols which we discuss in brief. So let us see part 3, 6-point toolkit: comfort, language, question style, active listening, reflecting, rephrasing, summarizing. We will just see all these 6 points in brief. Whenever you talk with a patient, you should be prepared for the following. If the patient cries, if patient is insistent, doesn't want to tell you anything, is shocked, be prepared to stop the interview at that stage. Do not proceed, do not insist, do not pressurize. Let the patient have that right. If he wants to continue, he will continue, otherwise not. You have to repeat the questions time and again, because patient is at a lower level, very weak. He may not understand your question, your language may not be understood him. So you might have to repeat your questions. Do not get angry. Patient may not answer your questions, he will just keep mum, he will maintain silence. Be patient. Patient may deny everything. Take the help of his relatives and try and break the denial, and there will be certain emotional reactions like anger, shock, this or that. Be prepared to deal with the emotions and then continue your dialogue with him. This is the most important: comfort. If you want to gather information from the patient, then patient must be comfortable to talk, and therefore such dialogues cannot take place in haste or in corridor or anywhere. It should take place in office or chamber, sitting down. Patient should be comfortable. If he requires some water, tea, coffee, just give him that and pamper him and then start talking to him. Comfort means physical environment, height of chairs, eye contact, everything matters. Normally patient always sits on your right so that you can physically examine him. Also, language. What is the meaning of language? You may speak fluent English, Shakespearean English, but the other guy doesn't understand English. Then what's the use of that language? Language means any language which is being understood by receiver. Language, the most important use of language is you want to convey a particular message, and therefore the receiver, the person who is receiving that, should be knowledge of that language. So try and speak that regional language which your patient speaks. Avoid medical words, complex words, jollying along jargons. He doesn't know. You have studied 5, 6 years, 10 years in medical colleges, but he hasn't studied anything at all. So, be compatible in matters of language with the patient. Question style. Basically, there are two types of question: open question and closed question. If you ask closed questions, you will not receive proper information. Therefore, ask open question. Open question always start with what and how. How did it happen? What is happening to your body? How do you feel about it? And closed questions: did you eat today? Will you get up? Should you go to that hospital if I refer it to you? The answers are yes or no. It will not continue, the dialogue will not continue, and whatever you want to get from the patient, it won't be possible. So, always try open questions and do not make use of closed questions. Just certain examples. Open question: how do you feel now? The patient will say, okay, better. But this is the answer you do not want. You want some description so that you can diagnose him properly again. You had given certain medications. Has it acted upon him or not? You want that particular feedback from him. Yes or no will not matter to you. Therefore, closed question: how is pain in your hand? Focused question for a specific information. Leading questions never ask. Direct questions eliciting a special symptom. Multiple questions, that you study all these things, but basically learn about open and closed questions. Leading question, that is basically legal term. You generally get the answer what you want from the patient, and closed questions you just get yes or no. Case history is very important. It is his story, it is the story of the patient, and if you want to extract this story from the patient, then you need to talk to the patient for a length of time. How do you talk? That is where your effective communication comes into account. Listen to the story, do not interrupt. Active listening we will see later in week number 2 of our course. Active listening. I will just narrate a small story, it is about a school. A child was studying in standard 1, very brilliant child, and he was a favorite of the madam also, the school teacher, good in maths. So, one day madam asked the child, if I give you one apple, another apple and one more apple, how many apples will you have? Child immediately said 4. Actually, madam wanted the answer 3. Madam thought, the child didn't understand my question properly, so she asked the question again. Listen, my dear son, listen to me properly. If I give you one apple, another apple and one more apple, how many apples will you have? The child got confused, because why the madam is asking the same question again to me? There must be something to it. He started counting on his fingertips, 1, 2, 3, 4. The madam 4. Madam got wrecked. My dear boy, again listen. Now she raised her voice. Listen to me properly now. If I give you one apple, another apple and one more apple, how many apples will you have? When the voice was raised, and the child saw that the madam is angry, so again he started counting, and again he came up with the same answer 4. Then madam rushed to the child and took hold of his hand and said, why 4? Why not 3? Child went down, put his hand into the bag, and took one more apple. My mom had given me one apple for the nasta. So you give me 3, I have got 1, so I got 4 apples. Madam did not listen to the child properly. Madam confused the child with so many questions. Active listening means what? You listen to the answer of the child also. Think about it, why the child is just saying 4, 4, 4. Similarly, a patient may be saying anything. Doctor must listen actively and time and again must repeat the question with politeness and should come to the proper answer of the question. Then only medical history can be written. Summarizing each and every dialogue must have proper summaries. Okay, what is to be done? Summary means what? Action point. Patient and doctor, they had a dialogue for about 10-15 minutes. Finally, doctor could diagnose something. Now everything comes on his prescription. Now he will say, okay, fine. This is what I know and this is your problem. I given this prescription, this is the medicine. Go to the drugstore, medical store, buy this medicine, and this is how you have to take the medicine. You will get okay. In summarizing, you must ask for feedback, recall. When the medicine is over, you must come and visit again so that I recheck your position. I see how much improvement has taken place. That is very important. You have to call the patient again, okay, what has happened so far, and then you can decide for the next approach. Communication problems, bad news, any information that drastically alters a person's view of their future for the worse. Denial, psychological shock breaker that allows us to suppress mentally what we cannot accept emotionally. Collusion, as I said, implies information being withheld by some and not shared with significant stakeholders, that is the patient. Anger management, appropriate short-term reaction to diagnosis of serious illness, encourage expression of anger. Difficult question by patient, show interest, empathize and explore reasons behind it. Now we come to the part 4, communication models. We call them protocols. A communication protocol is a system of rules that allows 2 or more entities of a communication system to transmit information via any variation of a physical quantity. The protocol syntax, semantics and synchronization of communication and possible error recovery methods. Protocols may be implemented by hardware, software or a combination of both. I will discuss 5 most important protocols in medical communication. First is the class protocol. Class is the acronym, so that you can easily remember and you can follow it during your practice. Class protocol is basically meant for initial conversation between doctor and patient. That is where he gathers the information, first time information about the sickness of the patient. Similarly, here in social circle also, whenever we meet a stranger or somebody first time, this particular protocol we can apply. What is class? Class is an acronym. It is easy to remember, like when we are students, our science teacher used to say that there are 7 colors in a rainbow. We could not remember. Then he gave us an acronym, VIGYOR, VIBGYOR. We understood it. I can rattle it now. VIGYOR, that means rainbow has got 7 colors. violet, indigo, blue, green, yellow, orange and red. Similarly, if you understand this acronyms of all the 5 protocols, then whenever you talk to a patient or talk to a senior doctor or talk to a nurse, and you can implement them properly. C means physical context, the sitting position between patient and doctor. L, listening skills. A means acknowledge the emotions. Naturally, if somebody is talking about his disease, the person is very happy, the person is very unhappy, he is going to try, he is very sad. So, explore his emotional reactions, show sympathy, show empathy, don't show apathy. No, this has happened to so many patients, why are you so upset about it? No, this is not the way doctors behaves. He has to show sympathy, empathic, yes, fine, this is what is happening to you, we will see, something can be done about it. Let us hear the story full and then we diagnose what is to be done about it. Management strategy is that once a case history has been written, proper investigation has been done, now you come down the diagnosis and then you say how to sort it out, which way, that is called management of the disease. And finally, in almost all the protocols, the final thing is summary, where you must contact the patient again, that when your medication is over, or this particular test is over, come back to me, report to me, meet me here in this room at so and so time. Without summary, no protocol, no communication, dialogue is over. That was the first initial discussion between doctor and patient. Now, sometimes what will happen? Difficult situation, a patient will not answer at all. Difficult situation, how to extract information about his disease. So, in such a situation, we have got a respect protocol, where mainly we are supposed to respect. R means rapport, develop some sort of happy rapport with him, let him laugh, smile, talk to you nicely, then explain why don't you answer me my question, can you give me something, explain me something more. Slowly and slowly he might answer you. Show. There is something called 7:1 complement ratio. 7 times talk about his good points. Correct? You are such a nice guy, you have studied so much, you are healthy, this or that, and then come back to last one. 7 times praise him, appreciate him, and then finally say, okay, in such a condition, such a nice fellow, why don't you answer this, tell me something about it. Show empathy, extract the information, practice. This doesn't come all of a sudden. I said, if it is art, it may come to you. Art is generally inborn, but if it is science, it needs to be learned, needs to be practiced. Communication is art and science, therefore you have to practice it, and yes, practice may make you perfect. Empathy, you will see empathy everywhere. In most of all these lectures of 12 days, certain words will come time and again, because I told you this is what the palliative care is. We are low tech and high care, and high care can be shown to the patient only by communication, use of empathy, sympathy, compassion and hope. Empathy examples, C रिस्पेक्ट के अंदर जो सी आता है RESPECT, सी कोलैबोरेशन, T trust, develop the trust. Third is the nurse protocol. First I said class, start having a dialogue. Then I said nurse, when some difficult question comes up, apply nurse. Now you need more information. When you ask something, a patient gives just 1 or 2 words, small words, and he just says, then thereafter it doesn't go further. We want continuous statement so that a patient gives its full story. How to make the patient talk and give out the full story about his condition, about the history of his ailment, that is where we use nurse protocol, continuous statement. Nurse name, state the patient's emotion, what the patient is thinking psychologically, state it, yes, I know. This particular disease has happened and you never expected it, so you are under shock. I understand it very well, but something can be done. State, go along with the emotional feelings what he is having by means of showing empathy. Understand, empathize, legitimize, yes, I can understand, this has happened to many people. I understand fully well what is happening to you. You are under so much of pressure, you are under so much of stress. Respect, appreciate, praise the patient for strength, but in spite of all these things, you are just, you see, you are still holding yourself. All the way you came from your village to me, that means you got that strength. Appreciate, I just said that, compliment ratio, 7 times compliment and 1 time give the correct picture. Support and explore, ask the patient to elaborate. That explore part requires continuous statement. If you keep on asking, yes, then what happened, you will be able to take out the full story. Spikes, most important protocol in palliative care, because there is always a time when you have to break the bad news. Particularly when the lab report comes in and you come to know as a doctor that the patient is suffering from something very dangerous disease, stage 3, stage 4 cancer, and as per the present situation, he may not survive very much, and this needs you have to give it out. You are breaking the bad news, and that is where we make use of spikes protocol. Remember this, what is bad news? Any news which changes the way a person looks at his future, that is a bad news. Anything, when something serious happens. When I was young, I was about 38, 39 years old, and I had accident in my tank, serious accident, and that particular thing changed my whole vision. What is going to happen? Will I be able to walk again or not? So anything, any bad thing which happens, which changes the way a person looks at his future, bad news is always a bad news, my dear friend. There is nothing good about it. If your wife gives you salty dish, namak zyada hai, that means it is there. There is much salt in your dal or sabji. Similarly, bad news is always a bad news. Only its impact can be lessened through proper communication. How do you empathize? How do you treat him? That's the way that psychological reactions of the patient will be reduced. Breaking bad news is like breaking an egg. If you make an egg omelette or any other dish from the egg, you have to break the egg, and you have to apply a proper pressure on the egg with both of your thumbs. If you apply more, the eggs will be broken, the shell of the egg will be broken, and the whole yellow and white will fall onto the ground. You will not be able to make use of that egg. That much pressure, that limited pressure what is required to break, to give a little crack on the shell, and then finally you will be able to take out everything. Here also breaking bad news is like breaking an egg. How are you going to tell him? Bluntly, politely, which way? That will give the result, outcome. Spikes protocol, I will just give you what does the spikes mean. S means setting. Setting is the same generally. You sit down in a closed space in a room, not in the corridor. A doctor is sitting in a chair, and of course the patient is there on his stool just nearby. No other interruptions, nothing. Perception, invitation for information. Yes, like if you got bad news that the patient is suffering from cancer and he has got very few days, maybe stage 3, stage 4, then naturally give invitation, inform him. How do you slowly and slowly, in Hindi we generally say, जोर का झटका धीरे से देना. Ask him, do you know anything about cancer? Any of your friends or any of your relatives had suffered from cancer? What was their fate? Slowly and slowly bring him to that line. If the patient is intelligent, he will definitely understand. If he understands what he is suffering from, your work has become simpler now, because he has not totally accepted. He has not totally accepted the result of the lab report, but he has generally accepted, he knows it. Now it is for you to put it very politely. There is invitation for information, knowledge. Do you know anything about this? How much do you know? He will say, yes, this or that, this is what had happened to my cousin or to my friend, he died of cancer. And this is how slowly and slowly you build up the story. Yes, now we are talking about the cancer, and particularly we are talking the cancer which is basically your result of your biopsies or whatever results of lab reports. Empathy now, and summarize and strategize. There are lots of things about breaking bad news just to go through. This time we are going to put all these presentations in reference materials. So in your own time you can go through them, as well as you can go through our recorded lectures also. Perceptions, knowledge, empathy. This is one question which a doctor has to cope. How long I have got, doctor? How many days am I going to live? How to answer that? Doctors are not God. Nobody knows. I mean to say, there are two things which nobody knows in this world. When is he going to take birth and when is he going to die? Nobody knows about it. Doctor also can't tell you that you will die today or tomorrow after 1 month. And definitely sometimes most of the people, particularly in palliative medicine, doctors will be asked this question, and how he goes through the answer. It is a technique, we call it a rolling horizon, hope for the best, living one day at a time. There are so many tactics, so many designs which one of them he might employ. This is the last thing about breaking bad news. We are not reporters. Normally what happens in newspapers and TV channels, there is something called TRP, they want to raise the TRP. And therefore they always add mirch, masala in the normal news also. No, we are not. We are doctors. We are professional doctors. We are health professionals. We don't want to earn anything out of such bad news. Those people they will print it on the front page of the newspaper. At the television they will say breaking news, this has happened, this has happened. Here we are not reporters. Breaking bad news should be emotional, soothing. It should not pinch the receiver, it should not pinch the patient. An acceptable experience. Slowly and slowly the patient starts accepting it. Yes, this is the life now I am supposed to lead later on. Do not make it sensational. Oh my God, this is what has happened. Panic and disturbing. Take it slowly, take it professionally. Last is cons. This is again very important. After all, to err is human. Doctors, they are also human beings. They also make certain mistakes. And how to confess that a mistake has occurred to a patient or the relatives We have got a separate protocol that is called cones. Cones means context, opening shot, narrative, emotions, strategy and summary. Opening shot is always like this is what we apply even in breaking bad news also. That you question, you put up a question to the patient in such a way that he generally comes to know little about what is going to happen next. He gets an idea. Opening shot, if a doctor is saying ki anybody was a cancer patient in your family, this is the opening question. Any of your friends, or do you know anything about cancer? This is called opening question. Similarly, here also, to bring the patient at the plane level, you have to bring him up. Okay, yes, this is the place, this is the condition in which some error has taken place. It has taken place. There is no negligence, and this is what you have to explain. Otherwise, it will create medico-legal case. Therefore, Cohn's protocol is very important. Context, opening shot, narrative, emotion, strategy and summary. Last thing, never lie to a patient. Never, कभी उसके सामने झूठ मत बोलो. उसको जो हुआ है, slowly and slowly release the information so that he can digest it. Not all of a sudden that this is what has happened. Slowly and slowly, like how we treat our children. Similarly, a patient also needs to be treated like a child. And avoid thoughtless candor. Be sympathetic. Don't be haphazard. Don't have apathy towards the disease as well as the patient. There are 10 commandments. That's 10 commandments they were given on Mount Sinai by Moses. Similarly, we have got 10 commandments what a doctor should do in matters of communication in palliative care. Thou shalt not do all the talking. Doctor will not talk. He will let the patient talk, give a story. Thou shalt not force your conviction. Will not be assertive. Will not force your thoughts. Patient has got all the right to accept your thoughts, to accept your prescription, to accept your diagnosis. He can have a second choice. He can go to another doctor also. Thou shalt not make assumption. Thou shalt not be patronizing, condescending. You will not say, oh my son, this is what has happened, I don't like it. You are like my son. This is not required now. Those family relations do not come here. Do not patronize. Tell him frankly. Tell him everything like a professional should tell. Thou shalt not moralize, philosophize, oh, everybody has to die. Everybody knows everybody should die. But if this thing comes from a doctor that everybody has to die, it doesn't carry anything good to the patient. Thou shalt not draw comparisons. Thou shalt not sympathize. Thou shalt not avoid jargon. Thou shalt avoid lies as well as thoughtless honesty. Thou shalt avoid inappropriate humor. Thank you, friends.